All right, osteomyelitis first. These are two different things, so don't think these are interrelated. Osteomyelitis, osteobone inflammation of the myelocytes in the bone. So basically the infection that they had from probably a cellulitis got into their bone. Here I'm going to try to draw a foot. No toes. All right, so this person ends up getting cellulitis, let's say. Let's say this person's diabetic, which can happen. They end up getting a swelling. You know, their skin looks yucky. It's all red and like hard and weepy, and they develop a cellulitis. It's warm to the touch, even in the foot area. And they're treated with antibiotics. Blood sugar's still high, and they just can't get it down. Well, they find out, they do a bone scan and realize that it's gone into the bone. Well, that's osteomyelitis, so it actually gets into the bone. Obviously, we know there's more bones in the foot, etc., and in here too. So with this is when we think, okay, this person needs a PICC line, and they're going to be on long-term antibiotics, at least 6 weeks, because that's how long it takes to get into the bone, penetrate into the bone, and actually remove the infection. So, and you don't want osteomyelitis. It's dangerous. You can lose an extremity. You can become septic and die. It's one of the most common things we see in rehabs, short-term rehabs that are in nursing homes or rehab centers, is they're there for long-term antibiotics. Can some people go home and do it? Yes, they can. But a lot depends on insurance and that kind of stuff. But just so you know that these people are on long-term antibiotics. All right, now let's go to low back pain. So, oh my gosh, here's a body. Low back pain, which we're talking about L1 to like S1 and S2. So you have like this whole area where they have back pain. And it used to be years ago, we would put people in the hospital and they'd be on traction for days with low back pain. But we have found, research has found that no, these people need to move. All right, so let's ice it for the first 24, 48 hours. But after that, you need to start getting up and stretching it. Because many times low back pain, especially if they're not having symptoms that's like hitting on a nerve, which would cause numbness, tingling, shooting pain, it's most likely because you have the vertebra here, but you also have muscles on each side. And a lot of times the muscles are just inflamed, and then it's kind of just pressing in and causing those symptoms. So it's the paraspinal processes, paraspinal muscles that are causing the problem of the back pain in the first place. Even if somebody has a disc that's protruding out, many times we treat it conservatively. So we treat conservative here, and over here is surgery, which really we try to avoid because the success rate is not even really high with surgery. Obviously, if there's an emergency where when we talked about the areflexic, the cauda-equina syndrome, areflexic bowel and bladder, yes, that's an emergency. They need to go over here right away. Most of the population, we're over here at conservative treatment, which is going to be your ice, and then you go to heat, alternating, exercise, Tylenol, muscle relaxers. So this is where we go with this. And then if that doesn't help, we can do some physical therapy over here. Now let's just say they come back and that doesn't help. Then we're doing an MRI to see what's going on. So really, and an x-ray. When people come in, the guidelines are not to get an x-ray because most of the time it's inflammation, and the x-ray is not going to change the outcome of what we're doing. We're still going to do all of this first to see if they can get better before surgery. These people with back pain, and this is what I tell my patients, this is very important to hear, this is how their life is going to be. If you have any disc issue, this is how it goes. And this is no different than like many other issues we have in life, anxiety, depression, whatever. You're going to have peaks and valleys. No back pain, all of a sudden something happens where you turn the wrong way and you have an issue. Okay, you go through all this workup and you find out you have a slip disc or something, but it's not really affecting the nerves. So we do physical therapy, reduce the inflammation, then you're back to here again. And then maybe, let's see, you can even go 10 years and now you have a problem again. So this is how it works. But in order to have it be more like this, maybe small, you need exercise. Because think about the muscles in your back, they need to be constantly stretched. They need to be strong. So the stronger you keep muscles around the bone, the better. And that's no different than what we tell anybody as they're aging. Because remember, you're not building up calcium anymore. Women especially are losing calcium. You need to build the muscle around the bones, which is why we say weight training is so important. So it's the same thing with back pain. You need to keep that core strong and the muscle strong around there. Let's just say this person needs to have surgery. And they do like a laminectomy, which is a common surgery. Let's say they do a laminectomy of like L4 to L5. All right, so that's a common surgery. They usually end up doing multiple levels by that time because they have a lot of issues. They're going to have an incision on their back, and post-op care is really important. And it's going to be with any post-op care, you're going to watch their vitals and things like that, and nausea, vomiting, that stuff. You're going to watch the incision, but just so you know, like that incision, having clear liquid come out of it is normal, but if you start having like pus drainage, like colored, a little bit of redness is fine. And actually, sometimes when the healing process is happening, it can itch a little bit, and that's just the healing. Small amount of redness is fine. Not a ton of redness, but mild is okay. It's normal to not have an appetite because remember, they're having anesthesia. And with these patients, you want to make sure you're turning them also because they might be on some activity restrictions immediately post-op. All right, and that's it.